Hi guys, welcome to our gross anatomy lecture. So today we're going to talk about rotator cuff tendinitis. What is a rotator cuff? So a rotator cuff, it consists of tendons of muscles that actually stabilize the glenohumeral joint, stabilizing the humeral head on the glenoid cavity. So these are the tendons that are given the mnemonic seats, right? So you're going to have your subscapularis, supraspinatus tendon, infraspinatus tendon, and teres minor tendon. These tendons are important in stabilizing the joint. So most part of the joint is stabilized by the rotator cuff muscles. And we say that these rotator cuff muscles, they are deficient inferiorly. Therefore, the inferior portion of the joint is actually the weakest part of the joint. Take note of this. The rotator cuff muscles, they are actually attached to the underlying capsule, also strengthening the capsule as well. So in cases where there is inflammation of these tendons, we are going to have the stability of the joint being affected. So such a condition is called rotator cuff tendinitis. Most of the most common tendon to be to undergo inflammation due to wear and tear is the supraspinatus tendon, because the orientation of the supraspinatus tendon is that it passes from the supraspinous fossa of the scapula, and then it moves below the acromion, attaching to the upper portion of the greater tuberosity. So this is a potential area for the supraspinatus to undergo friction. Let's take a look at another diagram. Right, this is your supraspinatus muscle attaching to your greater tuberosity of your humerus. You can actually see this is your acromion here. So the supraspinatus will actually, due to excessive movement, there can be tear of this supraspinatus, or actually inflammation of this supraspinatus, leading to rotator cuff tendinitis, or what we call spinatus tendinitis. There is actually a bursa that extends from this region to the inferior portion of your deltoid, that is called a subacromion or subdeltoid bursa. Let's take a look at this bursa. So right here, this is your acromion, and you can actually see the supraspinatus tendon attaching to the upper portion of the greater tuberosity, and this is what we call your subacromion bursa. So in cases where there is degeneration of this bursa, you're actually going to have what you call subacromion bursitis, and this can actually lead to pain, right, in abduction of the arm, right, pain in abduction of the arm. And if there is a rupture of the supraspinatus, there's also going to be failure in the initiation of abduction. Remember, it is the supraspinatus that is responsible for initiating abducting from 0 to 15 degrees, right? So if there is a rupture, there is actually going to be failure in the initiation of abduction. So thank you so much. This is everything I have for you for today. See you next time and take care.